So today we are going to talk about the antiemetics, means these drugs which are used for vomiting, for stopping the vomiting. We call it as the antiemetics drugs. Okay, so this is GIT another part. So basically we'll talk about first the morning sickness. So morning sickness, like we know that the pregnant female, especially in the first trimester and second half trimester or till second trimester, some of the women they feel like vomiting, so much vomiting in early morning, so that is morning sickness. So for that doxylamine we use doxylamine. With that we use vitamin B6 for antiemetic for the pregnancy morning sickness. Okay, so we use doxylamine plus vitamin B6. It is safest antiemetic in pregnancy. Then for motion sickness means someone is traveling and that person is feeling vomiting like or getting sick, so getting feeling nausea, vomiting, some like that. Okay, so for that we will prescribe to the patient hyoscine is basically a transdermal patch, also known as the scopolamine. It is a transdermal patch which is put in behind our ear, like uh, like this. Okay, transdermal patch. Okay, and we can say it is a drug of choice for the prophylaxis of the motion sickness. Okay, then other certain like drugs which are used for the prophylaxis of the motion sickness, those drugs can be antihistamines, for example promethazine. Okay, or like for example diphenhydramine, so certain drugs. Okay, then another one is drugs for the chemotherapy as well as radiotherapy induced vomiting. Like when the person is on chemotherapy or on radiation therapy, that time what happen is that a person like as a side effect will feel the vomiting. So for certain vomiting we have to stop that vomiting, and for that we will use the 5-HT3 blockers, like for example ondansetron. Okay, then for example pelanosatron. Then for example another one like ramocetron. Okay, ramocetron can also be used. Okay, so this for example this chemotherapy or like radiotherapy induced vomiting, we can say early and late phase. Like in early onset vomiting, what happens is we will give 5-HT3 blocker which end with cetron, like ondansetron and all. Okay, so these are the drug of choice, and also these these 5-HT3 blockers, they are preferred in like post operative vomiting also. Like after operation the patient is feeling vomiting, for that also. And the 5-HT3 blocker, these are safe in case of pregnancy also. Then another one is for late induced vomiting, the vomiting which is inducing by this chemotherapy and radiotherapy later in life. Okay, or at late stages. Okay, so that we can use neurokinin 1 blocker we can use. Okay, so for example ralopitant, which the drugs which are ended with pitant, ralopitant, or either aprepitant, or either the fosaprepitant, or either netopitant, etc. So basically these are the drug of choice for late onset chemotherapy and radiotherapy induced vomiting.